dog. Originally presented last month in September for non-ambulatory paraparesis. After an MRI, we saw that he has a compression at T12, T13. He underwent surgery and he's been recovering since then. Mom and Dad say that we're still crate resting.
Good.
When they sling walk him though, they see that his left pelvic leg curls up and he's putting more weight on his right back leg. Other than that, he's having no pain, no discomfort. They say he's very hyper, very happy now.
Hi, good boy. Okay, let's see him walk. Or try to walk, maybe. I love this shirt.
Right?
It's like the perfect size for him. It's like it was made for him. You're very festive. You're ready for fall.
Let's go.
Good job, Kobe. Okay, we got some movements. Good job, Kobe. So this is Kobe. He is our 5-year-old male intact French bulldog. So he initially came in, you can keep walking. He initially came in for acutely being unable to walk. He could not move his back limbs but could still feel them. So we did an MRI for him, which did show that he had a herniated disc between his 12th and 13th thoracic vertebra. And he immediately went for decompressive surgery. After surgery, while he was in hospital, he did get some subtle movement back in his back limbs, which he is showing more strongly for us today at his 2-week recheck. So now he's got some pretty noticeable motor in both of his back limbs, and he's very comfortable on back palpation. Still not walking on his own yet, but he's got a great prognosis to return to walking again with some time and good rest. He looks really good today, okay? So, yep, so his incision is all healed and healthy, on good palpation of his back. He's non-painful. He's got much stronger movements in both of his hind limbs today, a little stronger in that right back one. But he is showing strong movements in both of them. When we sling walk him, he's got a lot of energy to try to walk with his forelimbs, and then he's trying to take steps with those back limbs, dragging the left one a little bit more, but the movement in them is much more obvious today, so that's a wonderful sign. So he's got an excellent prognosis. He is going to walk again, but it's just going to take time and some rest, okay? Okay, the incision is healthy and healed though. Yeah. Okay? Perfect. So John Claude, our 10-year-old male castrated mixed breed dog, so he presented us today for suddenly being unable to walk yesterday. So it was just at home. The owners got home and noticed that he was no longer using his pelvic limbs correctly and was more affected in his right back limb. On his exam today, he's unable to walk but still has strong movements in his back limbs. He's much stronger in his left back limb. He also has some reduced reflexes in his back right limb, and he is not painful on palpation of his back. His skin twitch reflex is cut off kind of around his mid-back on the right side. So we have localized him to a spinal issue, most likely more right-sided, somewhere between his 3rd thoracic vertebra and his sacrum. So Eli is a 7-year-old male castrated golden retriever who came in to see us after several days of having some difficulty walking and developing a head tilt to the left. On his exam today, he had a really marked head tilt to his left. He had some abnormal fast eye movements, which we call nystagmus, and he had some trouble walking as well, where he was leaning and listing to his left. So we went ahead and did an MRI of Eli's brain to look at his brain and the structures around the brain as well. And what we found is that he does have a deep inner ear infection on his left side, and you can actually see that here on this imaging here. This is called a T2 weighted image. Within the inner ear here, so this bulla, there's a lot of bright material inside of his inner ear, and that is evidence of otitis interna, otitis media and otitis interna. On here, this is an image after giving a contrast agent, which is going to make inflamed areas look bright. We actually see some little areas of contrast enhancement within the area of infection of his inner ear on the left, but also very subtly along this area here, which is part of his brain stem. He does also have a thin area of brightness or contrast enhancement here of his brainstem. So there's a pretty thin bone between the inner ear and the brain parenchyma. So sometimes deep-seated infections can actually break through that bone and cause some inflammation of the brainstem as well, and a bit of a deeper infection. So our plan for him is going to be to start him on some good oral antibiotics to clear up some of this infection. But many pets with this kind of infection also do need a surgery with a veterinary surgeon to clear out that inner ear to give them the best chance at clearing out that infection long term.